is it safe to share medicines?
All right. So when it comes to sharing medicines, there is a blanket answer. There's a blanket answer, and which is actually no, it's not proper to share medicines, even if it's to save money. And that is because there is this misconception whereby everybody believes that every medicine works the same for each individual. But that is a misconception, because the thing is, although we have the same genetic makeup, we are all different physiologically, and we all react differently to medicines, and it might differ. Like, for example, a medicine that you can take, I might be allergic to. So those kind of things, we cannot share medicines. And even when it comes to when you take your medicines, follow-up medicines from pharmacies, especially from government health facilities, they will actually, even though your name has already been printed on the label and your registration is already there, they will still ask you, is this, what is your name? And that is because to confirm that this medicine is indeed for you. Only that is because every medicine is individualized, and that's so you shouldn't share medicines, and then to save money. But when it comes to the 5R concept, basically, the 5R concept and its components were introduced by the Ministry of Health to promote the rational use of medicine. And what the 5R concept is, I'll just go through one by one. So the first R is the right patient, meaning that if medicine A is prescribed to patient A, it should be only taken by patient A.
Yeah. Okay.
All right. So the second right is right medicines, basically meaning if medicine A is prescribed for disease A, it should be only be taken for
Disease A.
Yes, exactly. And the third right is the right dose, meaning that a doctor will calculate a dose for you, and you shouldn't increase or decrease the dose according to your liking. And then the fourth R is the right route of administration, which means if you have a tablet that's meant to be swallowed, it should be swallowed only. If you have a cream that's meant to be topical cream and meant to be used on your skin, you should just apply it on your skin only. And the final R is the right time. As you know, medicines, they have medicines that 4 times a day, which means has to be taken every 6 hours. Medicines that should be taken at 3 times a day, which is every 8 hours. And then we also have medicines that only should be taken at night.
Yep.
At night before you sleep, and there's some scientific reason for that, but we'll not go too
too deep into it.
But so basically, those are the 5 R's, and it just promotes the rational use of it.
Yeah, but of course, and also for instance, the right timing, right?
Yes.
There's some medicines you only should take after a meal. You shouldn't take before a meal.
Exactly.
There's some medicines you cannot even take if you even plan on driving after that.
Yes.
Yeah, especially the flu medicine. One flu medicine, the yellow color one.
Yes.
Yeah. Right. So now moving on. If someone has or shows the same conditions or symptoms, I think this is like a follow-up to the answer that you said earlier, right?
Yeah.
Could the medicines not be shared?
Yes. The thing is, when there's also another misconception whereby if you have the same symptoms, people think that you have the same disease. Chances are the diseases are very different. Like, for example, if person A and person B both have fever and they exhibit feverish symptoms, it could be that their sources of infection are very different. Like, for example, person A may be a bacterial infection and person B might be a viral infection. In those cases, the medicines are very different from one another. So that's one reason why you should not share medicines even if your symptoms are the same. And the second reason is that when a doctor prescribes a medicine to an individual, he takes into account a few things. Number one, he takes your age into consideration, he takes your weight, he takes your possible interactions with other medications that you're taking, possible allergies, as well as the status of your current disease, its progression. So taking all that into consideration, even if you have the same disease from one person to another, there's possibilities that your medicines, its dose, or the type of medicines that you're taking might be very different from one person to another. So in those cases, you shouldn't share your medicines, and it is up to the doctor to decide what is the best medicine for you.
Yeah, first things first, outward symptoms might not be of the same disease.
Yes.
Right? And then secondly is something as simple as weight could also increase or decrease the efficacy of the dosage.
Exactly.
Right, so that is quite crazy, right? Like if you are 70 kilos and someone who wants to take is only 40, that might be an overdose for them,
Yes,
right? So
exactly.
please don't share the medicines. Absolutely. All right, so now we'll move on to the next question. And another common query among parents is it possible to share medicines for such as fever medicines, cough medicines, or antibiotics for children?
All right. So this answer is basically split into two. Now, the thing is, certain categories of medicines that are usually used for chronic diseases like asthma, those kind of medicines. Those kind of medicines are very risky to share. They shouldn't be shared because at all because without sufficient knowledge and without first consulting your doctor or a pharmacist or any healthcare professional, you shouldn't share the medicine because it may cause more harm than good. That's the first part of the answer. Now, the second part of the answer is that we have non-prescription medicines, which we call over-the-counter medicines.
Yeah.
So these medicines we can buy from 99 sometimes, even 7-Eleven sells them.
Yep.
Like, for example, Panadol. Panadol is an over-the-counter medicine. Those kind of medicines are less harmful than prescription medicines like for chronic diseases. So in those kinds of situation, it is not supported. Sharing is not supported. We don't endorse sharing, but we allow it provided that the person you're sharing the medicines with is not allergic to the medicines and knows exactly how to take it, its dose, its frequency, its route of administration, and that information can only be obtained from a healthcare professional.
Yep. But I mean, something as simple as paracetamol, I think that shouldn't be too much of a problem, right?
Yes.
Like someone else bought it for themselves and you have a headache, you can be like, hey, pass me a couple of paracetamols, and they should be able to do that, and that shouldn't be a problem.
Yes, but of course we have to take into consideration that whether the person has any allergies. Like, for example, there are some people
who are allergic to paracetamol.
Oh, yeah, exactly.
Yeah.
So that information is very vital, and it's very important to know that beforehand for sharing your medicines.
Yeah, but considering paracetamol is one of the medicines that we use most often,
Yes.
I think by the time you're like 6 or 7, you know if you're allergic to paracetamol.
Yes,
But
exactly.
is there a possibility that you gain an allergy later in life?
There is a possibility that as we progress through life, our body undergoes physiological changes.
Yeah, that is true.
That's very rare, but it can occur.
Yeah. Physiological changes like putting a lot more weight around the
Yeah,
stomach
you
and all
may
that.
never
lah.
know.
All right. What about antibiotics? Can they be reused or shared with other children in the family who have the same illness? Antibiotics especially, we are going to focus on that.
Okay, all right. So when it comes to antibiotics, there's a blanket answer for that, and we are very stern with that, whereby we are saying no, never share your antibiotics, because the thing is, an antibiotic is prescribed for an infection and is very, very specific. So the thing is also there's not necessarily that if patient A has an infection and patient B has another infection, it's not necessarily that it requires antibiotics in the first place. Back to the original argument whereby, it might be bacterial, it might be viral. In the case of viral, it doesn't require antibiotics. And in this kind of irrational use of antibiotics, whereby using antibiotics to treat infections that does not require antibiotics in the first place, will lead to something known as antimicrobial resistance. And antimicrobial resistance is an instance where the antibiotics that used to work to cure a disease caused by a bacteria does not work anymore. That means that bacteria has somehow developed resistance to that particular antibiotic, hence antibiotic resistance. And in our modern age, that is a serious problem, because the rate of resistance, antibiotic resistance, is higher than the rate that we are producing new antibiotics.
Yep, we actually had a conversation recently on Health on Tracks as well about how we are actually running out of antibiotics, different and new versions of antibiotics, even for something as simple as the cold.
Yes.
Right, yeah. So I still remember when I was younger, each time I got sick, the doctor would prescribe an antibiotic. Each time.
Okay.
Each time. So like, I always thought if you get sick, you have to take antibiotics. But then as I grew older, I realized that's not the case. So if your doctor's going to prescribe you antibiotics at the clinic or something like that, because I don't think it happens in the hospitals anymore.
Yes.
If the doctor's going to prescribe you antibiotics, ask them, is this really necessary, right?
Yes, and on top of that, if it is necessary, ensure that you take the antibiotics exactly as prescribed.
Yes.
Finish it all. And if, let's just say, there is a balance, like usually antibiotics for children, they come in syrups.
Oh yeah, syrups. Yeah, for children and syrups.
Syrups. So the thing is, those kind of there will always be balance from that. So discard the balances appropriately. And also, if let's just say you have an infection, never use antibiotics that's prescribed to another person for yourself, and even use their balances for yourself.
Yeah, because one, your dosage will not be accurate because you won't have enough because the other person has been using it.
Yes.
So, and you also at the risk of developing the superbugs and antimicrobial resistance. Keep hearing about that; it makes me scared because I've read some horror stories that regard about antimicrobial resistance.
Yes.
So that is messed up.
And actually, what you said earlier was actually very true, because we actually only have about 100 or so antibiotics currently available worldwide. And the rate of resistance is going up. That those hundreds is probably not enough. And these 100 antibiotics can cure everything from the range of mild infections to very severe infections, you know, and that is why a doctor will usually use diagnostic tests to actually determine what exactly is required for you.
Yeah.
Which is why antibiotics are very specific and they shouldn't be shared at all.
Absolutely, because they are very targeted. Jeevan, is it inappropriate for parents to give their kids the same medicines to treat common illnesses like fever, flu, or cough?
Okay, so I'm going to assume that for common illnesses, we are referring to over-the-counter medicines, not prescription medicines. So the thing is, one thing that parents should always keep in mind for each of their children is that these doses for their children are always calculated based on weight and age, and that varies across each children. And for common illnesses like using OTC medicines, yes, it is all right to share, provided that the parent knows exactly how to calculate the dose for each of their child. And as usual, that information is obtained from either the doctor or the pharmacist. But also, I have to say that not all over-the-counter medicines are suitable for all children, because there are some over-the-counter medicines that cannot be taken by children below 2 years old.
Yeah, that is true.
Yeah, because children below 2 years old, they have not developed the mechanisms to metabolize the drug in their body. So in those cases, those children cannot take those over-the-counter medicines. And usually there is a label warning on all these over-the-counter medicines. So yeah, and in any case, if let's just say those over-the-counter medicines don't work, self-treatment does not work, you must always go back to your healthcare practitioner to seek further advice.
Yes, absolutely. Because I think, especially with the advent of Google and the advent of the internet,
Yes.
I think a lot of people believe that they have enough information to make informed decisions about things like this, especially sensitive things such as dosage, usage of medicine, and all that. A lot of people seem to think it's a conspiracy to also, right, like to push expensive medicine on you. But the thing, it is not. You cannot use certain medicines for certain kids.
Yes.
You cannot use other people's medicines as well. It's not a cost thing.
Yes.
It's a safety thing.
Yes, exactly.
Yeah. And apart from antibiotics, can medicines for chronic diseases such as diabetes, hypertension, heart disease, or cholesterol be shared? Like if there's an emergency, I might just add on.
Okay, so this one is a bit of a long answer. Okay, so all prescription medicines, which are medicines that are required for chronic diseases, now they should not be shared, because the thing is, the actual diagnosis of an individual and the pharmacotherapy or other medicines that are provided to them might be very different from one person to another. You see, when a doctor actually decides what medicines to give you, if you have a chronic illnesses, he takes into account your family history, the disease, the current state of the disease, the history of the disease, as well as your lab results, your lab results that come out, let's just say your blood results, an example. And it's based on these things that the doctor will decide, okay, so these medicines are best for you. He also takes into account possible interactions with other medicines that you are currently taking for other chronic diseases that you might have. And it also takes into account possible allergies. So taking those things into consideration, so even if let's just say you do have the same exact diagnosis, there's a chance that you probably will not be taking the same medicines. We can use an example. Let's just say Auntie A and Auntie B both have diabetes.
Okay.
And they're both taking medicines for the diabetes. But the thing is, we realize that Auntie A and Auntie B, Auntie A is probably taking a tablet form of the anti-diabetic medicine, whereas Auntie B is taking insulin. So we cannot share these medicines because they're very different medicines. And also we have upon further research, we actually find out that actually Auntie B cannot take Auntie A's tablet form of medicines because she's allergic to them. or because they have interactions with other medicines that she's taking, or even worse, because those medicines do not work for her as well as insulin does. That's one example. Another example would be like, if let's just say Auntie A and Auntie B both are taking tablets, the same exact tablets, but there's possibility that the doses might be different. Like Auntie A may be taking 1 tablet twice a day, Auntie B may be taking 2 tablets twice a day. And that is because Auntie A is more sensitive to the medication rather than compared to Auntie B. So when it comes to actually sharing medicines, it's basically a blanket rule, especially for chronic diseases, is not to share them. Because medicines are very individualized. And regarding the information that you said, people actually find online because of the advent of Google. Well, the thing is, we always encourage patients not to trust sources from illegitimate places, like testimonials, or anyone who says that, or anyone who's not a healthcare professional who says that, it's okay to share medicines, because it truly is not. And if you want to actually obtain good information, solid information, legitimate information, it should always be from healthcare professionals, like pharmacists and doctors.
Yep. And I always believe that, especially things about health, right? A lot of people seem to think, like, as you say, the word that you use, a blanket,
Yes.
right? It's sometimes it is one cannot be used for the other.
Yep.
Healthcare is very custom. It's always tailored to you.
Yes.
And that's why you need to meet a doctor, you need to meet a pharmacist, you need to let them know what you are going through so that they can custom make a plan for you.
Yes, exactly.
Yeah.
That's exactly right.
Just like nutrition as well.
Yep.
But I would like to ask you, in your long experience as a pharmacist, have you ever had to see the effects of sharing medicine before?
Unfortunately for me, because I'm usually in...
Behind the office.
Yes.
Okay. So
I never had a chance to actually see that happen. But the reason why we're having this talk here today is because it has happened numerous times before. And it happens usually in a very at the local level, the ground level, whereby sometimes we only find it out once we have gone for something known as the home medication review, where we send pharmacists to see people how they're practicing their medicine usage at home, and we find out they've been sharing medicines, storing medicines improperly, and those kind of things.
Yeah, I mean, I do have to admit, at this point in time, I have been guilty of sharing medicine
Yes.
before, but it's definitely OTT or
OTC.
OTC. Yeah, OTT is the other thing. OTC medicine. Like for instance, especially when I have a cold or something, I tend to use whatever medicine my wife bought lah.
Okay, all right.
Yeah, but that was over the counter, so that is a disclaimer.
Yeah.
But before we end for today, Jivan, as always, a pleasure talking to you.
pleasure.
What is your take-home message? How should patients take their medicine? Avoid the practice of sharing medicine. And also, I'd like to also hear from you, because you said this earlier. How should they keep their medicine?
Okay,
Yeah.
all right. So when it comes to sharing medicines, well, basically every medicine, every pharmacotherapy is very individualized. You should not share them, except in certain cases, over-the-counter medicines, whereby you're not allergic to the medicine, you know exactly how to take it.
Yeah, one pill, go to sleep.
Yeah, that's okay. And then also, I would like to say that every individual who is taking their medicines should know exactly what they're taking. Not only like, I'm not talking about the name. I mean, the dose, also the route of administration. I'm talking about exactly the chemical name. The chemical name, or
The active ingredients.
Yes, the active pharmaceutical ingredient.
Yep.
So, like for example, if let's just say you are taking a hypertensive medication for hypertension, let's just say you're taking, for example, amlodipine 10 mg once a day. You can go anywhere in the world with that information, and even if you lose your medicines along the way, you can always go to a healthcare practitioner there, tell them, I'm taking this particular medicine. Is it okay after your evaluation you give me my medicines that I need to control my, that kind of information is very liberating and it's very powerful. You can carry it anywhere you want.
Yeah,
And
like write it on a card and keep it in your wallet.
yes, and I mean, if you can commit that to memory also, that's
that's
really,
much
that's
better,
always
yeah.
fantastic. And then also, one more thing is never to increase or decrease your dosage according to your liking. Always consult your healthcare professional for that.
Yeah.
And the relating to how to store your medicines properly. Basically, general rule is that every medicines come with storage instructions. Storage instructions whereby, if you need to store it in the like in room temperature, you can store it in a cupboard that is away from any heat sources or humidity sources like your bathroom and all that. If you need to store it in refrigerator, when you place it in the fridge, place it inside the fridge near the blower. So that's where the temperature is like always, always
constant.
Yes, always constant. Yes,
Yeah.
always constant.
Okay.
So that's basically it. But do not store medicines that are meant to be stored in room temperature in your fridge, because sometimes the humidity may affect the temperature's physical appearance and also its efficacy. Yeah.
Right. So,
Yep.
okay, that's something I need to learn.
Yeah.
I tend to keep my medicine in the fridge.
I'd like to add one more thing, if that's all right. This is something away from the usage of medicines.
No problem. Go for it.
Yeah. So, So in the pharmaceuticals, in Ministry of Health Facilities in the pharmacy department, we actually offer services whereby individuals who are taking chronic medication, follow-up medication, they can skip the queue of waiting in the pharmacy department and obtain it directly at a time that is most convenient to them. So these services are called value-added services, pharmacy value-added services, and in this term, there's a number of services underneath them. Like, for example, we have pharmacy drive-through, which is exactly what the name implies. You just drive through, there's like a pondok there. You just go and just take
Your medicine?
their medicines, at a time that is designated for you. And then you can have medicines delivered to you at your doorstep by a post or by third-party couriers. And then also there's another service whereby it's called the medicine locker, where there's a designated location where the Ministry of Health will build lockers, and you can go and take your medicines from those lockers in a certain time, once again at your convenience.
Wow. So it's much easier to get to your medicines after that.
Yes, much easier. You don't have to wait in queue. And I do have to stress two things, that these services are only for individuals who are on chronic long-term follow-ups, so they have to take medicines every month. And also that the services, their names might be different from facility to facility. Like, for example, in certain facilities, it's just called medicine locker. For other facilities, it's called locker for you. So it's important.
It's branding.
It's branding, yes. So the thing is, person has to go to the pharmacy facility and do ask, I want to take my follow-up medications. What services do you offer in your value-added services? What is the name and such? And also, if one more thing I would like to add, if anybody who's listening has any information about medicines or how to take them or the rational use of medicines, they can call the National Pharmacy Call Center. That is, the number is 1-800-886722. It operates Monday to Friday, 8 a.m. to 5 p.m. and except on public holidays.
Yeah.
And if they like more, and if they want to read about more information like this or hear about more information like this, they can always visit Kenali Ubat Anda, Know Your Medicines, Facebook, Instagram, or TikTok.
Okay.